All right. Welcome to this week's episode of the Herbal Hour podcast. This is episode 27. We have the great and the marvelous Dr. Joshua Korn on with us today. Dr. Korn is a naturopathic physician that has a private practice out here in Oregon. He specializes in men's health, addiction, and chronic disease. In this episode, we dive into his take on the health at every size philosophy, how men can stay healthy, things they can do, natural treatments for the most common male health issues like ED, for example, and the naturopathic approach to addiction and what causes addiction. Thank you guys so much for listening and supporting the Herbal Hour podcast. I have some exciting news. We have had over 1,000 downloads in just the last 30 days, in this last month. We have listeners all around the world listening to these topics in natural health. Thank you guys so much for your support, and I hope you guys enjoy this episode. Also, if you're the type of person who likes watching the video episodes to a podcast, we have a channel on YouTube. Check us out. It's called Herbal Hour Podcast. So if you want to see our pretty faces, that's the place to go. We would also love to hear what you guys have to say about the podcast. Topics that you like, topics that you want to hear about. You can comment on our Apple Podcasts, or you can go on our YouTube channel. We'd love to hear from you guys. Without further ado, here's our guest. All right, Dr. Korn, welcome to the podcast.
Thank you. Very happy to be here.
Yeah, I've been on clinical shifts with you, and we've had many great conversations, and I think this is a great opportunity to get in depth on a lot of great topics. So can you tell us today how you got started in naturopathic medicine?
Yeah, I think particularly germane to the podcast that you do, it was really all about herbs. When I was a kid, my mom's friends, one year for her birthday, bought her a bunch of herbs and planted an herb garden for her because it was the 90s and I'm from Asheville, North Carolina. So, it was like cool to be kind of crunchy hippie. Mm-hmm. So she had an herb garden. They got her a few books and my mom liked it. Okay. But I loved it. I was like always in the garden, always reading the books, super into it. So that really became kind of my hobby. And then I wanted to like collect every plant that I could. So whenever we went to nurseries or plant shows or stuff, then I would always be looking for a different herb that I could put in the garden. So it was just always something I was really drawn to. And then in undergrad, I did international studies and geography. So I've been interested in how cultures work and how people and social movements kind of function in societies. And when I was thinking about what to do for grad school, I was initially interested in ethnobotany and learning about how traditional cultures use plants. I did some volunteer hours at the North Carolina Herbarium, which if you don't know what an herbarium is, it's like a library of plants. And I got to help with the cataloging of the grasses of New Brunswick, which was real boring.
The grasses, like, those aren't like medicinal or anything.
No,
right?
they're not. And it was like, I understand that these things need to be done, and I'm happy that there are people out there doing it, but
you didn't want to be the person doing it.
Yeah, it was like, 6 hours a week of me gluing grasses on pages with labels and stuff. And like, glad somebody does it. But I was like, I would like to do something that's a little bit more interactive with people and maybe does more one-on-one good. So that's how I found naturopathic medicine. It was a way to use something that I've been always interested in and kind of take it to the next level, kind of beyond just like, I like herbs, I grow some in my garden, I make really simple tinctures and medicines and stuff, but I don't, when you're a layperson and you aren't exposed to like everything that we get in our education in the community and like all the teachers we have, it's kind of hard to understand exactly like how big the world of herbal medicine is. So that was really cool coming to the school and coming to Portland and kind of seeing just how much is out there.
So you were in the research program at UNM, right? What inspired you particularly to go into research? Because in terms of natural medicines, although research is getting better and better, it's something that's definitely been pretty lacking, actually.
For sure. Yeah, I think that was part of it, is that I wanted to understand how the research part of medicine worked and how we could use that to further what we do. And when you actually start digging into the research, there's lots of studies on what we do and what we use. It's just maybe they were really small or they weren't the best quality because of financial funding concerns. And so I was really just interested in figuring out, like, how do we make that better? What are, like, we're doing things in our medicine that have really big impacts on people. So how do we get that out there? How do we, like, systematize that? Because a lot of us use the same stuff. We use the same plants. We use the same protocols. How do we put that out into the world so that, it gets attention, it gets more studies behind it, and there's more evidence, and then it's more widely used. I think ideally that medicine, is not divided up into conventional and naturopathic and osteopathic and chiropractic, like all that stuff. I think those are just kind of false labels. It's like, I think medicine is medicine. Like, what works, works. And a lot of what we do works really well.
That's a really, really good point. Especially, are you familiar with the eclectic physicians? Mm-hmm. Right. So they were basically like MDs in the early 1900s who used herbs, but they also maybe used pharmaceuticals if they needed to.
Yeah.
So like that divide comes like later of this idea that there's this like alternative holistic practitioner, and then there's this like conventional doc, when really not that long ago, everyone just used whatever worked. They would use an herb for this, they would use a pharmaceutical for that, they would do surgery for this, they would, do a diet for this.
Well, I think of it like that. It's I really think that's one of the beauties of kind of our education. What we learn is that like we really try to do what works at the time and what works for the patient, and where they are right now. And that's different for different people. So I think it's cool to get that experience and to see that, because I think in the end, that's where healthcare has to go. Like, what works, works.
Yeah, absolutely. I mean, as much as the current healthcare model has been resisting bringing in herbs and other alternative therapies, and how much resistance insurance companies have put up, people have such a big desire for them that now they kind of have to just comply, basically. They really have no other choice because of the interest in it.
Yeah, it's true. I think there's more and more interest in that. And I think, honestly, as healthcare gets more and more expensive and access to healthcare honestly gets less and less in this country, there's more interest in more traditional forms of treatment. And when you look at the research, I think that, the scientific research we have is certainly good support, but also traditional uses of plants, that's evidence, that's research. Like it is maybe not a randomized control trial, but it has been done over hundreds of years, thousands of years in some cases, to figure out how do these herbs work, how do they work best, what do they do, what other herbs can we use them in combination with to make them more effective. It's like with turmeric, like if you just take plain turmeric by itself, you're just going to poop it out. You're not going to absorb it. It's that traditional knowledge piece that you need to use it with fat or black pepper to help the absorption of it, that's where we really see it have an effect. So now we see supplements that have those things in them to help with the bioavailability. But so I think like pulling from traditional uses, from the scientific research, kind of just marrying all those things together.
Absolutely,
like that.
Yeah, I love that idea. I'm obviously very into the traditional aspect of herbs, and I think there's such a wealth of information about them. And if anything, if one wanted to approach it scientifically, I think it can even guide research. But I kind of had this thing that I've been thinking about, like, what's the best use of research in the natural sphere? How do we get beyond just confirming things that may or may not be true based on tradition, and get into like actually learning things and finding new medicines from herbs?
I think those are two different questions. Finding new medicines from herbs, I think that can go into like pharmacokinetics and pharmacology and that kind of, like how do we isolate compounds and find a medicine from it? I'm not as much into that as I am figuring out like, how does this whole system work? And I think really that my research interest now, when my graduate thesis work was actually on an herbal formula. It was on the hemp formula, which is hydrastis, echinacea, myrrh, and phytolacca that we use for strep throat. Nobody had ever researched that before. So I wanted to figure out, like, does it actually inhibit bacterial growth? So that's what it did. It does. But my research interests now are more kind of, how do we get out of that confirmatory, like, this individual treatment works, to what does the whole system do? Like, does our system of medicine work? Because we all practice a little bit differently, but is the system as a whole working? And I think there's some preliminary research in that from CCNM, the Canadian College of Naturopathic Medicine in Toronto, that is showing that as a system, naturopathic medicine is effective. So I think that kind of exploring that more deeply, I think that's my future with research.
I like that idea. There's this case in Tibet. They had this conference. I forget. It was a very, very long time ago. I think it might have been like before 1000 AD or something like that. And they brought together practitioners from all around the world, and they all had the same patients, and they just looked at who as a whole could help those people the most, and kind of compared them, and then they kind of learned from there. So like looking at maybe comparing not like an herb versus a pharmaceutical, but like how a naturopathic physician practices compared to an MD on the same exact patient, and what the results are long term. I mean, it's kind of like a competition in a way, but competition is also good for like making people better, right?
Well, and I think totally. And I think that we also can frame it not as much as a competition, but just as ways that we can learn from each other. Right? Like, I think that MDs, I've worked with a lot of MDs in my residency and my internship years. They do lots of things really great. Naturopathic doctors do lots of things really great. Like, everybody has their strengths and weaknesses. And so I think like seeing what are the strengths and weaknesses of these whole systems is really what's going to get us to where medicine is not so compartmentalized, and it's just like what works, right? And I also think that understanding that different systems are going to work for different people. Some people kind of, and this gets into the more like woo-woo energetic parts of our medicine.
Good, that's the part
which I really like. This is the art of medicine. It's like, not everybody is really ready to talk about how their high blood pressure is related to traumatic events in their past. Like, they're just not ready to have that. And that's fine. Like, for them right now, taking a pharmaceutical is what they can handle, and that's fine. And when they're ready to get into the root causes and really figure it out, I think that changes what kind of medicine they need. So I think, the naturopathic modalities are maybe not right for everybody all the time, but there's always a time and a place for them, for everybody, just kind of where they are.
Agreed. Yeah. Meeting people where they are is a big and important thing, really in medicine, but really just in personal relationships in general.
Totally.
So I have a question from a audience member about male health. I know that's something you're very interested in, and we'll definitely dive super deep into that topic. Just to start that part off, Tiffany Mayberry asks, what can modern low-maintenance males do to stay on top of their health? So how often should they come in? What yearly special tests do they need? And what kind of self-care exams?
Good question. I think, prevention is the best medicine. It's one of the tenets of our medicine, and in general, it should be one of the tenets of medicine as a whole. But I think the prevention piece sometimes gets lost. Men, like young men, generally healthy men, don't necessarily need yearly exams or tests up to a certain point. If there's family history of certain things, high cholesterol, diabetes, heart disease, that kind of stuff, then we'll do that. I think the most important thing is to just have an established relationship with a doctor, so that you can talk to them about your family history, about your personal history, and see where are the pieces that you could adjust, right? So with men in general, they don't like to go to the doctor in our society. 40% of men would only go to the doctor if it was an absolute emergency, according to
like if their leg fell off,
like
or
if
something.
exactly,
and then they would still like hesitate a little bit about it, like
I could probably fix it.
It might regrow.
Yeah. So, that's kind of a cultural, societal thing. Like, how do we get men to engage? And I think that what I try to do is not be too pushy about, you need all of these things and we're going to change everything about you and we're going to just completely adjust your life on this first visit. It's really about developing that relationship. Because, a 30-year-old guy comes in to establish care with me. I don't want to make the visit real long. I don't have to get into super deep stuff if he's not into it. It's really just establishing that relationship so that in 10 years, 20 years, we can have those conversations about okay, now as you are getting older, here are some things that we can think about. I also think that with anything, but especially health, it's not about perfection, it's about consistency. So having consistent relationship with a provider is important, but also encouraging our patients to make those consistent small changes. That's where we really have a big impact.
And that's where it's usually most difficult, right?
It is. Which is like, I try to start real small. I'm like, let's eat a vegetable. One vegetable.
Just like one broccoli?
One broccoli a day. Like, for some people, it really is that. It's like, can you eat one little bit of broccoli every day? And they're like, yeah, I'll do it. And then you slowly work your way up. Some people, they're already there. It's just, again, it's that meeting people where they are.
What's your approach when somebody has tried everything lifestyle-wise? Where do you go in there? So there's cases I've heard of people with, sleep issues that they've literally tried everything.
Mm-hmm.
Everything that they do is impeccable. Their sleep hygiene's amazing. They get exercise. They eat great. They meditate every single day for an hour. How is someone like that? What do you start thinking of then?
Well, that's when I like to get weird. I want to talk about your emotions and your traumas and your life history, and I want to talk to you about astrology and drainage remedies and all that kind of stuff that, like, if everything else has been exhausted, there's still something there. Physical manifestations of disease and imbalance are very often emotional issues that just have gone unprocessed, right? Like, in a lot of ways, if we think about like emunctorology and naturopathic medicine, like we talk about the liver and the kidneys and the lungs and all that kind of stuff, those are physical emunctories. But I think that in general, our whole body is an emunctory for our soul, for our emotional body. And so when our emotional body, when something's not right, it's going to express itself somewhere. And it's not necessarily in one of those emunctory organs. It can be anywhere. So that's what I like to get into with that.
What have you noticed in terms of males? What common kind of psychological and mental emotional issues have you noticed with them specifically?
A lot of disconnection, loneliness, and I think a lack of a sense of purpose. I think that's one thing that really plagues males in our society today. I think in general, our generation is really so disconnected from everything. Like, we have this illusion of being connected all the time on social media, and like obviously we're both on Instagram, and like, we do that. Like,
Shout out.
Totally. Like, follow us on Instagram.
Follow us on Instagram. Let's just put that in there. And now let's talk about how Instagram's terrible and destroying our lives.
But I mean, I think those things have a place, but it's so easy to get sucked into that world and believe that you're having real authentic connections with people when really, like, it's a wall, it's a mask. It's just you're putting up what you want people to see. And we are substituting actual intimate relationships, and I don't mean just like sexually intimate, I mean like emotionally intimate relationships, for that kind of facade of social media. And I think in addition to that, I see a lot of men kind of in this Peter Pan syndrome world, where it's like there's not a whole lot of responsibility. There's not, in our generation, I think, like, we have dating apps. We have, and I'll just be honest, a lot of times dating apps are just hookup apps, right? You just like find somebody, hook up, have a good time, and then you never see them again. Like, there's no need for commitment and responsibility, and I think that those are actually really good things for people in general. But I think for men, when they don't have that, they really kind of get in this position of like, I don't have to do anything with my life. I can just like hang out and go out drinking and play video games and just like kind of perpetually be in this like early 20s world. Whereas I think in our society, we generally expect that women are going to do most of the emotional labor. So even if women are not, even if they are not in a committed like romantic relationship, they're still taking care of their parents and other family members, and they are still like fulfilling those roles more than I think men do when they don't have that commitment piece and that like responsibility piece. So I feel like that drives a lot of mental emotional issues for guys, because they kind of feel lost. And with that, I think there's a lot of anxiety that comes up. There's a lot of pressure from society with men that like nobody likes to talk about. Like, men are expected to look a certain way, act a certain way, behave and, you know, like function a certain way. And I think that's really challenging for lots of guys to not be able to talk about how hard that can be.
Yeah, that brings to mind Dr. Peterson's work. I don't know if you're familiar at all with it, but he talks so much, so extensively about the thing that most men and really people in general are missing is more kind of responsibility in the sense of meaningful activity of their life and you know being accountable for something, moving towards something greater, having a purpose essentially.
Yes, I totally agree with that, and I feel that I think that social media is honestly one of those things. And again, like I'm not trying to dog on social media because I'm on social media, but I try to keep that perspective with myself that like it's not real. It's not getting you anywhere necessarily. Like I have my Instagram, I think you do too, for the purpose of like trying to connect with people in the real world and like make a difference for people in the real world. Like that's the ultimate goal with that. But yeah, I totally agree. I think we don't have that connection. We don't have the connection to each other and the responsibility to each other. And I think you can see that everywhere in our society. Like everything is so divided and polarized, and like there's not that mentality of people working together and understanding that like we're all in this together as a whole world. Like we gotta come together and do stuff.
Yeah.
So yeah, I think that causes a lot of issues.
Yeah, like a lack of sense of belonging, lack of community. You know, how many people could say they even know their next door neighbor these days? That's unheard of if you look, 100, 200 years ago.
Totally.
Everyone depended on each other
even
to survive.
like my grandparents, like I remember growing up, I stayed with my grandparents a lot while my parents were working. Like they knew all their neighbors. I knew their neighbors. I went to their neighbors' houses all the time. Like I don't do that now. I don't interact with my neighbors.
Yeah.
Yeah.
I occasionally see my neighbor walk in and out, and I'm like, oh, I forgot I had a neighbor. So what is some of the most common issues that you see males facing in terms of like physical disease processes, things like that?
Yeah, I think dependent on the age group, like with men in their 50s, 60s, heart disease is kind of the biggest thing. So that's the number one killer in this country, and that oftentimes goes back to diet and lifestyle issues that we're all exposed to all the time. But I think also a lot of that goes back to stress, and I see stress as being, I don't know, it's kind of for me like the number one cause of disease. It's something that I really struggle with too, because like I work a lot. I thrive on stress too. I thrive on stress, and then I'm just like burnt out all the time. But I feel like our culture is just, that's where we are. That's kind of how everyone operates. Well, when you do that for 30, 40 years, it takes a toll.
Yeah.
I also see lots of guys for like sexual health and wellness, and a lot of that ties into cardiovascular health as well, because erectile function essentially is vascular. It's a cardiovascular disease in a lot of ways. Like if your vasculature is not functioning properly in your penis, you can't achieve an erection. That should also point to the fact that it's probably not functioning properly elsewhere in the body. So it ties into that, but it also ties into that mental emotional piece we were talking about as well. So with anxiety, with that need to, the standard that men hold themselves to and feel like they cannot achieve that standard, and then that really plays into their erectile function, inability to like connect and have intimacy with someone, because we do live in a society that really values sex over intimacy, emotional intimacy in a lot of ways. And I'm not like saying that that's necessarily a bad thing. I think that having a healthy sex life is good, but having a balance is good too.
Right. Yeah, and we live in a time that's just very go, very like sympathetic nervous system, always burning. And the interesting thing is you can feel great for a while doing that, especially if you're doing something that's meaningful for you, or you're fulfilling some kind of purpose. You feel like you're, getting ahead, you're moving forward. But eventually it takes a toll on you, because like the body has a limited amount of resources, and we don't really have this cultural idea of the importance of like rest.
Right.
Which I think other countries do a little bit better, like especially in Europe.
I agree. We do not prioritize rest at all. I think we look at rest as weakness.
Like laziness or
It's
something.
laziness,
Like, why
yeah.
would you need to rest? Like, you should just
Exactly.
work like 15 hours a day, go to sleep, and just do it again,
Yeah.
and just until you die.
Exactly. Yeah. I so I part of my week I spend at the Men's Residential Center, which is a residential drug and alcohol treatment facility, and I have supervised student shifts there in the past. And one of my students really had a kind of a breakthrough moment with a patient, because he was in this go, like he was in recovery, and he's going to do perfect, and he's going to work out, and he's going to like eat great, and he's not going to smoke with like everybody else does. He's just going to do everything perfectly. And of course he got burned out immediately. And she said, you're doing everything else like a badass, you got to rest like a badass. Like you've got to like actively rest. And that just like blew his mind. He was like, oh, okay, I got to rest like a badass. Like, is that okay to say badass on your podcast?
Yeah, it is. It's preferred, actually.
Okay, great, perfect.
It's a badass podcast if anybody's listening right now.
So
The Herbal Hour.
I hope this. I can't call this student out, but hopefully she is listening, because I thought that was so cool, and that really changed his perspective. But I agree with you. We're always in a sympathetic state. Like we never rest, and I'm guilty of that as well. Like I don't ever rest either. My way of resting is like, I work 6 days a week, and then on the 7th day, I'm just exhausted. And like, that's not rest. That's
It's just, you just like sit there and you stare at the wall, and you're just like, I don't know if I could do this next week.
exactly.
again.
And then it's like, okay, I'll do it again.
You wake up, you're like, I guess I could do it this week.
Sympathetic drive again. Here we go.
So what are your go-to therapies and approaches you use for, a patient who comes in and they're just completely burnt out? Where do you start with that?
Well, it kind of depends on where they are on the scale of being burnt out, right? Like if we think about how adaptogens work and how we kind of conceptualize that term adrenal fatigue, right? Like, does adrenal fatigue exist as a medical diagnosis? Who knows? But it certainly exists as a functional diagnosis. So I think if someone is just kind of always pushing themselves and they're stressed and they're not sleeping super well, kind of in that beginning stage, I use ashwagandha a lot because it is a more sedative adaptogen. It calms you down a little bit more. It's not, it's not going to ramp you up too much, and I don't want them to get ramped up too much. So use that a lot. Use a lot of phosphatidylserine, fish oil as well. All three of those have been studied to help with adrenal function, HPA axis function, and sleep. And lots of times people just need to sleep better, and then they'll feel a little bit better. I think beyond that, you get into this place of needing those more stimulating adaptogens, ginseng, eleuthero, rhodiola, those kinds of things, to help support the adrenal gland and support sympathetic function. At some point, people get themselves into a place where they know that they need to rest and they know they need to take it easy, but they've overcommitted and they just can't. And so I think we can spend a lot of time telling people that they need to rest, but if somebody's got a family, there's only so much they can do about it. So being able to support them to get through that until they can start taking some things off their plate, I do a lot of work with that.
Meeting them where they are, let's say they have a newborn or something, and you're telling them you need to get more rest, and they're like, I can't sleep. What do you mean? How am I going to get more rest?
Yeah. I have a patient who I've worked with quite a bit on this over the past few months, who has, 2 very active teenagers, and they are constantly trying to get them to all these extracurricular activities, and they're on traveling sports teams, so they travel with them all the time. Both parents work full time. They have aging parents, they're just kind of going all the time, and they can't take very much off their plate. So we are using some like adrenal supportive, in a more stimulating way, supplements and herbs with them than I probably normally would do if somebody can take stuff off their plate. Ideally, the best the best cure for that kind of stress is to just get it out of your life and actually rest.
Right, just remove the stress if you can. That would be the best.
Yeah,
if it's a negative kind of stress.
Right.
If it's the stress of like doing what you want to do, then maybe there's a way to figure out. I think it also goes into spend a little time every day doing something that you really love.
Yes, I agree.
Doing something that's like useless. Doing something that has no like no idea of like productivity, especially for people who tend to like overwork themselves. What are activities like that for you? Like, what are your kind of unwinding things you love to do that you just enjoy that aren't really like useful in any sense? Maybe they're useful for your mental wellness, but
Well, I think for me, and one thing that I really recommend to a lot of my patients, and that I try to talk to my patients about, is social interaction and making a connection with other people. Because I notice when I am making a connection with someone who I just really can be myself around and I can actually relax, that I feel so much better. Like one thing that I do a lot to relax and kind of recharge is I just go watch dumb movies with my friends. And we put on a really dumb movie and we just make fun of it the whole time. And we laugh for 2 hours. And it's just like, it is so renewing for me because I just laughed with my friends for 2 hours. And I think that as we, like in high school and college, it's real easy to prioritize those things because you're always around your friends. And even in medical school, because we're around people 24 hours a day, like basically live with those people. But as you kind of get out into the world and into the adult world, and what you see is that like people don't prioritize friendship as much. And I think that really is something that can be very renewing for people. So I try to encourage people to take some time to do that. There was a research study published a few years ago that said men tend to benefit from having 2 nights a week of having like guys' nights, having time with their friends to just like unwind, relax, not with their partner, not doing work, just like be with their bros and hang out. And I really like that idea because is 2 nights a week feasible for everybody? No. But can you take 1 night a week and hang out with your friends and get some kind of like social interaction that is real in person? Just, and be silly. Like adults don't laugh.
yeah.
And like, we got to laugh. We got to have fun.
Right. You heard it from a naturopathic physician. Go out and have fun with your boys.
Right. Yeah, have fun.
If you're a guy, that's what you should do, especially on the weekends. I have to ask, what are your favorite dumb movies to watch? Recently that you watched?
Yeah, what have we watched recently? We recently watched The Fanatic, which is a film directed by Fred Durst. And it's John Travolta plays in it, and John Travolta is this like fanatic fan who stalks an actor, and it gets real weird real fast. But the movie's only like 80 minutes long. I think it was produced by Redbox, the like DVD rental service.
Oh, is it like a newer movie? Like, John Travolta's on the way out, I guess.
Yeah, it's not great, but it's a real good dumb movie to watch and just laugh at.
Yeah.
We also are a big fan of Battlefield Earth. Was that the one from the early 2000s?
Battlestar Galactica? Or?
No, I think it's Battlefield Earth with John Travolta again. It was like a Scientology project. Yeah.
Okay.
Yeah. So, but honestly, we'll kind of watch anything that's on.
So getting back into men's health things, what are some of the herbs you find yourself using most often for men's health complaints?
Yeah,
for which complaints?
Right. Ashwagandha is probably the most commonly prescribed herb in my practice because it just hits on so many things that people in general, but especially men, deal with. It's good for stress. It's good for athletic performance. There's some research that it raises testosterone a little bit, not a huge amount, but a little bit. It helps with sleep. It helps with blood sugar, blood pressure, cholesterol. There's all this like emerging research about what it can do. And I think because it is an adaptogen, our society just needs adaptogens in general. Like pretty much everybody could be on.
Right, like a daily multivitamin.
Yeah.
And that's actually how they're kind of meant to be used, especially something like ashwagandha. Is there any other herbs that you find yourself using?
For sure. I use tribulus a lot in my practice for libido issues. There's lots of products and information on the internet that said tribulus raises testosterone. There's no research suggesting that. But what tribulus does do, that the research suggests, and also in my clinical practice that I see all the time, is it really increases libido. So I use that a lot for confidence building with guys, because lots of times I think with erectile issues and intimacy issues, you kind of get in this place where if you have any kind of like performance anxiety about how you are going to perform during intercourse, erection is not going to work as well. Then you get in this vicious cycle of like, well, it didn't work that time. It's never going to work again. I just don't have any interest in trying, and that becomes really dangerous because like sex is essential for human life. I mean, obviously for procreation, but I think it's a big part of having a fulfilled life is having that intimate connection and the physical intimacy. So I use tribulus a lot as a confidence builder, really, to just like increase libido, increase desire so that men are able to engage in that more frequently. I also use, what else do I use a lot in my practice? I'm trying to think. For prostate specific things, I use a lot of nettle root for that. I think the research on saw palmetto is kind of mixed. The historical uses certainly show that it is effective. I've also used saw palmetto in PCOS for in a women's health world to lower androgens, and that worked for that. So I use saw palmetto and nettle root together, but I think that I like the idea of using the plants that grow where you live. And nettles are very common where we live, so I use that a lot.
What are some lifestyle approaches to those conditions you talked about, like libido and heart health?
Well, all of them relate to stress. So it's the stuff we've talked about, right? Like I spend a lot of time talking about sleep with people, how to improve their sleep, working on the lifestyle thing like sleep hygiene and not using screens at night and all that kind of stuff. Also, exercise is a big piece of what I do. I practice from a weight neutral, body positive angle. That's what I do. So I like working with people who have bigger bodies because a lot of times they've had crappy healthcare. And specifically with exercise, people who are not accustomed to exercising often don't understand what it means to exercise, right? It just means you're moving your body hopefully in a way that you like, hopefully in a way that is celebrating what your body can do, because our bodies are really cool. That's what exercise means. But a lot of times, and it's not just people in bigger bodies, it's, people who just didn't exercise when they were younger. They didn't play sports. They were, they were like me. They were in band or something, and they weren't playing sports all the time. So they don't maybe understand all those pieces. So I do a lot of like exercise prescriptions and just talking through like why it's really important to move your body, why it's important to develop muscle mass, why it's important to maintain muscle mass for metabolic health and cardiovascular health and mental health. Like just moving our bodies makes us feel better in general. So
absolutely, yeah. Especially if you could find a way that you really enjoy.
Exactly.
You'll be able to actually do it consistently if you actually like it. So there's this idea that like, because the research says that, this amount of exercise of this type, lifting weights is the best for health. I'm going to go force myself to do that, even though I hate lifting weights because it's boring. But there's so many other things you can do. And I think even just using another word like movement instead of exercise and just thinking of it in terms like that, like movement and like resisted movement and like explosive movement and like do things that make you use your body for what it's been created to do
I love
for
that.
millions of years.
Yeah, I love referring to it as movement because I think exercise has for a lot of people a really negative connotation. And I talk to a lot of my patients, especially older patients, like 50s, 60s, 70s, about strength training and resistance training. And whenever I say that, they're like, I don't want to go to the gym. I don't want to lift weights. I'm like, no, you don't have to. All you have to do is like do some lunges, do some squats, do some wall push-ups. These really simple things that anybody can do that's still engaging the muscles and having the same beneficial effect. There was a study released a couple years ago that showed that older adults benefited from 1 hour a week of resistance training. Just 1 hour for the entire week. Like you don't have to do very much. You can split that up, 10 minutes a day for 6 days. That's not much time. But there's a demonstrable benefit in reduced mortality from that.
Right. And one of the difficult things about that is everything kind of goes together, right? So if somebody's like overstressed and they're overworked, they're actually really likely to cancel exercise to do more work. And then they get into this vicious cycle that's very hard to get out of.
Definitely.
So you do some work with people with substance use disorders. Can you tell me a little bit more about that and like experiences you've had?
Yeah. So as I mentioned, I work at the Men's Residential Center. It's a residential drug and alcohol treatment facility. They are a facility that has 52 beds, so there's 52 guys there. I provide naturopathic services to them. They have a psych nurse practitioner on staff. They have counselors. They have social workers. It is a really well-rounded program that's very trauma-informed and very holistic from how it works. So it's not just about treating the substance use disorder, but it's about treating them as a whole person, which I love and really aligns with like what we do in our medicine. They spend a lot of time working on life skills with them. So I have taught a health class there, just do general kind of health teaching, like